Going a little bit more into detail here, we have intersectionality. It's the notion that intersecting categories such as race, ethnicity, gender, socioeconomic status, sexual orientation, or things of that nature contribute to injustice and inequality. Examples of this are social inequality, over-inclusion and under-inclusion, marginalization, social location, and matrix of domination. So this is something that we see in our everyday life, and I don't really need to go into more detail on it because you can see the differences in pay and quality of services in certain neighborhoods or states. So it's really a big deal. So let's talk about how we can deliver culturally congruent care. If you look back into our previous video, we talked about Leininger's transcultural care theory. That does apply here. The definition of culturally congruent care is that care fits a person's life patterns, values, and system of meaning generated by people themselves rather than predetermined criteria. Assume the role of a learner and a partner with patients and families. Determine what is needed to provide meaningful and beneficial nursing care. Effective nursing care integrates cultural values and beliefs of patients with perspectives as a multidisciplinary team of providers. This includes your psychologist, your therapist, your physicians, etc. Here are some key concepts on culturally congruent care. Respect the patient's beliefs as valid, whether or not they make sense to you. Forget your personal bias. It has no place in nursing. Be sure your patients understand what you're teaching them. If they have only a 3rd grade reading level, you need to find something at that level. If they speak another language, make sure you have an interpreter and appropriate resources that they can read. Ensure your plan of care is mutually agreeable. It's not just about what you prefer, it's about your patient. Patient-centered care is vital. And collaboration. You need to be working with everyone in your healthcare team to treat this patient. Cultural competency is enabling of healthcare providers to deliver services that are respectful of and responsive to the health beliefs, practices, and cultural and linguistic needs of diverse patients. So here we want to be sure we're valuing diversity. Conduct a cultural self-assessment. Manage dynamics of difference. Institutionalize cultural knowledge, and adapt to diversity. Culturally and linguistically appropriate services and standards are the principal standard, governance, leadership and workforce, communication and language assistance, engagement, continuous improvement, and accountability. There were a couple theorists pointed out in this section that I wanted to touch on. Campina Bocotti's model of cultural competency was that there were 5 interrelated components. We have cultural awareness of yourself, cultural knowledge, cultural skills, and cultural encounters, as well as cultural desire. Then we have Blanchett and Pepin. There are 3 dimensions. We have building a relationship with others, working outside usual practice framework, and reinventing practice in action. So what do these theories mean exactly? This means that we ourselves need to have the desire to know our patient and their culture. We need to take the appropriate steps to learn about their culture and what all that includes. We need to inform the rest of our healthcare team, and we need to institutionalize this. We need to make sure that everyone is on board with treating this patient in congruence with their culture. So let's touch a little bit on patient-centered care for our LGBT patients. We should be using gender-neutral language until we know what they prefer. We should be using a lot of neutral language, such as significant other or partner, unless they are married. Now that is legal in all 50 states. So if they are married, be sure to, of course, refer to them as their wife or husband as they prefer. We need to be non-judgmental regardless of what your beliefs are. And we need to just create a warm and welcoming environment for them, because it's not always easy. And as I said earlier in this conversation, they are at much higher risk for depression, anxiety, and suicide. And if we're making them feel unwelcome where they should be safe, we're kind of contributing to that.
So let's discuss the difference between an emic and an etic worldview. An emic worldview is an insider perspective, whereas an etic is an outsider perspective. Some notes that I made were to think that an emic is systemic, which means your system of viewing the world from the inside. For etic, you can think etiquette, how you behave around outside people.
Next, I'd like to touch a little bit on stereotypes. Avoiding stereotypes is very important. One example that always comes to mind is that everyone has pain-seeking behavior. So when you have a patient that is constantly asking for pain medicine, it's so easy for us to assume that they're just drug seekers. But to us, we have to assume that their pain is real, because to them it is. It is not our job to diagnose them. It is not our job to tell them that they have a problem. We can make referrals or bring it to the physician's attention, but our job is to treat the pain and treat the symptoms, instead of just creating stereotypes. So to apply culturally congruent care to what we're doing as a nurse, I'm going to give you some examples of some nursing assessment questions that we should be asking. Our questions should be open-ended and focused. They should have contrast. They should include an ethnohistory, sexual orientation and gender identities, any social organizations, socioeconomic status, bicultural ecology and health risks, language and communication, caring beliefs and practices. If you need help finding more questions or you need more specifics, you can observe Leininger's Sunrise Model, Geiger and David Heiser's Transcultural Assessment Model, or Purnell's model for cultural competence. They go into a little bit more detail and provide a good guideline for nursing assessment. We have the patient's explanatory model, and this helps us understand how they view their disease. So we ask them 5 questions to kind of help us get a foundation. Question 1 is the etiology, or the cause. Why did they think this happened? 2 is the time and mode of onset of symptoms. 3 is pathophysiology. How do they think their disease works? 4 is the course of illness. How long do they think this illness lasts? 5 is treatment of illness episode. This is not only how they feel their disease should be treated, but also what they've done to self-treat at home.
And finally, I have a few communication technique mnemonics. The first is learn. L is for listen with empathy. E is for explain perceptions. A is for acknowledge differences and similarities. R is to recommend treatment, and N is negotiate agreement. Next we have respect. R is for establishing rapport. E is for empathy. S for support. P for partnership. E for explanations. C for cultural competence, and T for trust. Next we have ethnic. E for explanation, T for treatment, H for healers, N for negotiate, I for intervention, and C for collaboration. Then we have C, Lara. C is for calm yourself down. L is for listen to patient perspective. A is for affirm connection with something shared. R, respond to what was said. And A, add, which is where you would educate if needed.
There are many ways that we can confirm that our patients are understanding what we're teaching them. Patients are notified both verbally and in writing to their right to receive language assistance services, and this is universal. This is for everybody. Good techniques for verifying that your patient is understanding you is to ask them if they understand, for one, and to have them teach back to you what you just taught, or have them show you. Good examples are blood sugar, finger sticks. They should be able to explain the procedure to you and then show it to you to verify that they understand. That's going to do it for our talk on cultural awareness. Just remember, our key points were that we should be eager to learn about our patient's culture. Culture does not just include their race, it includes socioeconomic status, social groups, gender, sexual orientation. We need to be thinking about how their culture affects how they receive health care. We need to think about nursing assessment questions that we can be asking, and we need to ensure effective communication and verify that they understand the communication. See you guys next time.